This 58-year-old woman, who developed fever, confusion, and seizures while on holiday in the Middle East, has an MRI that reveals some classic hallmarks of an acute viral encephalitis. Looking closely at the MRI, there is high signal intensity visible on both the T2-weighted and flare sequences. This high signal is bilateral, which immediately grabs our attention. It's particularly concentrated in the temporal lobes and is more pronounced on the left side. The involvement of the hippocampi on both sides is a significant finding. Why is this important? Because the hippocampus is highly vulnerable to infections, especially viral ones like herpes simplex virus, HSV encephalitis. This region's role in memory processing means that even a localized infection here can lead to serious cognitive deficits. The high signal extends along the sylvian fissures, involving the insular cortex bilaterally. This is another classic feature for HSV encephalitis, as the virus tends to affect structures within the limbic system, extending beyond the temporal lobes. What's reassuring, though, is that there is no mass effect, so we aren't dealing with a space-occupying lesion, and there is no hydrocephalus, meaning there's no abnormal buildup of cerebrospinal fluid to further complicate the clinical picture. The limbic system, which is involved here, is critical for emotions, behavior, and memory. When the infection spreads bilaterally and asymmetrically, as we see here, it often correlates with the patient's neurological symptoms, in this case, confusion and seizures. The asymmetry, with more involvement on the left, could also explain why some patients may exhibit more prominent symptoms on one side, such as weakness or speech disturbances. Given these radiological findings combined with the clinical presentation, we can confidently point toward acute viral encephalitis, with herpes simplex virus being the most likely culprit. This is a serious condition, and the imaging strongly reinforces the need for immediate antiviral therapy. Now, diving deeper into the broader picture of herpes encephalitis, HSV type 1, as seen in adults, has a predilection for these exact regions, the temporal lobes, limbic system, and insular cortex. The virus often spreads from the temporal pole across the midline, and in more advanced cases, you might see hemorrhagic changes within the affected areas. In this case, we don't see any signs of hemorrhage or mass effect, which can sometimes occur later in the disease course. The lack of hydrocephalus also keeps us focused on encephalitis rather than other intracranial pathologies like tumors or abscesses. And as we know, MRI is crucial for diagnosing herpes encephalitis because it gives us such detailed views of the soft tissues in the brain. The high signal on T2-weighted and flare images, especially in the temporal lobes, is a telltale sign. And diffusion-weighted imaging can help reveal even earlier changes by showing restricted diffusion in the affected areas. So, as radiologists, our role in identifying these subtle yet vital findings, such as the bilateral asymmetrical involvement of the hippocampi and the high signal in the temporal lobes, can make all the difference. Early diagnosis leads to early treatment, typically with acyclovir, which can significantly improve outcomes in what is otherwise a life-threatening condition. Without treatment, mortality can be as high as 40%, but with swift intervention, that drops to about 10%. However, many patients still face long-term neurological complications due to the damage caused by the infection. In summary, the key findings: bilateral high signal in the temporal lobes, hippocampal involvement, and the extension into the sylvian fissures and insular cortex are all hallmark signs pointing to herpes simplex virus encephalitis. Acting on these findings swiftly allows for early treatment and can greatly impact the prognosis. And that wraps up our case for today. Thanks for joining me on Radiology Made Easy, where we break down complex radiological findings into digestible insights for every radiology enthusiast. Don't forget to hit that subscribe button and stay tuned for more real-life cases that keep you at the forefront of diagnostic imaging.